All right, how's that? Can everybody see my screen? Okay, great.
To see you, we can hear you. Okay, Lindsay, thanks so much. You're on.
Perfect. So, my name is Lindsay. I am the executive director of Coastal Volunteers in Medicine. I've actually been involved with Coastal since the very beginning. I was actually a little bit of background about me. I was a founding board member. So back in 2009, a bunch of us kind of got together and said, you know, we recognized that there were some needs in Southern Ocean County for healthcare services for people. We did a feasibility study and we kind of sat around a table and literally were like, I don't know how to start a clinic. Do you know how to start a clinic? I don't know. What do we need to do? Who do we call? It took years of planning and sitting around the table to kind of create Coastal Volunteers in Medicine. So it's very near and dear to my heart. Can you see the faces of people on the side, or are you seeing just my PowerPoint?
I can see both.
All right, so how about if there we go. Better, so you can see the whole screen?
Yeah, I could see everything great.
Okay. So anyway, that's, it's very near and dear to my heart because I've been involved since the very beginning, and to see it grow into an actual clinic that's servicing patients has been amazing. I am a women's health nurse practitioner and also an emergency nurse in the ER at Jersey Shore. So just so you have a little idea about my background as well. Coastal Volunteers in Medicine is based on a culture of caring model. So we provide healthcare to the uninsured. And it's all through volunteer nurses, doctors, administrative staff. Everyone is volunteers aside from the 2 paid staff members that we have. Why? Of course, this isn't going to work now, is it? Oh, here, how about this? Okay, so who do we serve? There is an acronym called ALICE. I don't know if you've heard this term used before. Why is this jumping around like this? It stands for, maybe pause. Sorry. Okay. It stands for asset limited, income constrained, and employed. So in order to qualify for our services, patients can make up to 300% of the poverty level. So the ALICE population is, normal, regular, everyday people. These are people that, are working and making enough money to, but not enough money to afford like a bare bones household budget. So these are your childcare workers, your cashiers at the supermarket. When a lot of people, when I say we serve the uninsured, they assume that we are providing care to undocumented citizens, which we are. But in general, the reality is that a majority of our patients are employed and working hard to make ends meet. So especially in the area that we serve, we have a lot of seasonal workers. So, restaurants, hotels, the entertainment industry, those are, a lot of our patients that we're seeing. So our goals at Coastal Volunteers in Medicine, obviously to improve the quality, the life, the mortality rate of our patients. People don't always, if you don't have a PCP, a primary care physician, you're using things like the urgent care for your primary care. So for example, you have someone who has UTI symptoms, what are you going to do? You have really no options or no choice aside from using the urgent care resources as your primary care. We also look to reduce the use of the emergency department by not just, using it for UTIs and acute conditions like that, but also by managing their, chronic conditions. So by managing their diabetes, their, renal issues, we are keeping them controlled and helping them maintain their health before it reaches an emergent level where they need to use the ER. In addition, we have a lot of social services that are available. We have a social worker that sees our patients. And I think the next slide has the other resources as well. So once a patient is established with Coastal Volunteers in Medicine as one of our patients, and I'll go over that criteria in the next slide, they also qualify for a lot of additional services that we provide at our clinic. So through the New Jersey Commission for the Blind, we have screenings for vision, we have eye exams, they can get their eyeglasses for free. We also have a women's health night that's funded through NJ Seed, so cervical cancer screenings, breast cancer, prostate, colon cancers, all of those screenings are provided as well. We have a mental health counselor and also an advanced practice nurse that manages medications for our mental health patients. We have flu clinics, which they also offer COVID vaccines. Just this year, we also started having acupuncture clinics monthly, which has been very successful. So we incorporate the whole wellness into our approach with servicing our patients. Nutrition counseling, diabetic teaching. As I mentioned before, there is also social work. We also have in our, other things in our waiting room, there is a pop-up clothing shop from Seroptimus, there's toiletries, there's, other things that they qualify for through our services. So like I said, to qualify for our services, there's 3 criteria. One is that you cannot have any health insurance or qualify for any health insurance. So if you do fall within the guidelines of being able to qualify for Medicare or Medicaid, we would assist you with, obtaining those services. The second qualification is that you must have a household income at or below 300% of the poverty level. So for example, a family of 4 can make up to $83,000 and still qualify for our services. So this really helps us meet that gap of people who, don't qualify for government assistance, but also don't, make enough to really be able to afford that out-of-pocket cost for either insurance or, doctor's visits. And the third qualification is that you must live in Southern Ocean County. So there are specific towns and you must live within those specific zip codes. But as long as all 3 of those criteria are met, they would qualify for our services. Why? There we go. As you can imagine, one of our biggest challenges is obviously funding. Since we don't, since you can't have insurance and qualify for our services, we don't have Medicare, Medicaid, fees that we're collecting. So our funding is generated through private businesses, donations, employee match contributions. We do have some event fundraisers as well, but it's really, private donors and grants mainly fund our services. Here is just a slide about some some different ways that you can help support our mission at Coastal Volunteers in Medicine. So we do a lot of our events and fundraisers are mentioned on our Facebook and Instagram page. So that's a really great way to just like us there so that you can stay informed with the services that we're providing and what's going on. And I think that is pretty much it.
Thank you, Lindsay, so much. To be honest with you, when I first met with Lindsay, I was floored at like the small but mighty team that they have down there and all the services that are being provided strictly from volunteers. It's incredible to see such an effort. So thank you for sharing all of what you do. I see Sabine, you have a question. I think your hand is up. So go ahead. You can take yourself off mute. We're a manageable group today.
Yes, thank you. Thank you so much, Lindsay. It sounds like you really are doing incredible work. And I'm really happy to learn about this because I support the southern region of New Jersey as a patient navigator with Rutgers Cancer Institute and Screen NJ. And so I'm really looking to understand what kind of opportunities and care is being provided in South Jersey and what kind of needs exist. So our goal is really to ensure that we're able to support cancer screening, especially for the uninsured or underinsured population, really facilitating those connections to NJ seed sites as well. And so I wanted to ask you kind of what that process looks like on your end, since you are also using NJ seed sites. Are you as a team navigating your patients to them directly, or kind of how does that work? And is there something that our team can help you with?
So in general, our main program through NJ Seed is obviously our Women's Health Night with our cervical cancer and mammo screenings. We have Edna that comes to the site for those specific days. And, you know, she actually is the one that usually does a lot of the work with the patient. So we collect the PAPs, we order the mammos, and then Edna is the one that is reaching out and scheduling and following up on results for us. If we did have a patient, say, that had an abnormal pap smear or a mammo that needed follow up on, that would go directly through NJ Seed and they would follow that patient through the program.
Okay, all right,
And follow
understood.
up.
And then what about, so that's only for women's health. So you're not really referring anybody for prostate cancer screening or lung cancer screening?
So that we're also doing that. That's just through our family practitioners. You know, I thought of women's health because that's the one where we actually hold a specific event and have all of those screenings at that one visit. But the same thing applies when our family providers, when the patient comes in and they order either a PSA or a fit kit. That's all through Edna as well. So we do the point of care testing for the fit kits at our site. And then we let Edna know about our positive or negative results, and she would follow up with that.
Okay, great. Thank you.
Yeah, thank you.
And actually, Edna just joined us, and then we also have Ebony here, both of which are teammates of the SEED program for Ocean and Monmouth. So Edna, I know you just joined, but what we were talking about was the process with SEED and the Women's Health Nights. And Sabine was mentioning that through Rutgers CINJ, patient navigation, they kind of help families get to the screening services that they might need, and was wondering a little bit more of the process. So I wonder, I don't know if Sabine, Edna, and Ebony are already connected, but that might be an offline conversation to kind of have to see how we could support each other better there.
Absolutely, thank you. And yes, Edna, I see you just joined. I see Ebony's contact info in the chat, but Edna, if you could share that, I'd love to connect offline as well. Thank you.
Awesome. Okay, great. I had something to add to Lindsay's presentation. So I remember you mentioning the zip codes, that you have some limitations there with the folks that you're able to serve. And so Ocean Monmouth Health Alliance was just granted some funding that's going to take us through June, the end of June 2022, so this June, for transportation. So we've set up a collaboration with Uber Health to get patients to and from cancer screenings, preventative appointments, if they are maintaining their survivorship, or they have a caregiver that needs to get to the appointment with them, we can help to get them there through this Uber Health collaboration. So if ever there is a need in that regard, please rely on us, and let's help us to spend this money so that we don't have to give it back to DOH.
Absolutely.
And then, does anybody else have any questions for Lindsay? Okay. All right, feel free to put them in the chat as we go. I'd like to take a moment and transition to ask Gina Haranis to take herself off mute and talk to a little bit of the survivorship initiatives that we have going on. We've been working with Gina and her team, and we have a big event coming up on June 7th at the Strand Theater for cancer survivors, their loved ones and caregivers, and of course, service providers. And there's a couple of things happening prior to that event that Gina is going to talk with us about.
Great. Thank you, Jenna. Good morning, everybody. It's nice to see. I've seen some of you before, having been on a couple of these meetings. It's nice to see you again. So as Jenna said, my name is Gina Haranis. Normally my colleague Retha Onatiri joins me, but was not able to join us this morning. Together, we've been engaged by the Monmouth Ocean Health Alliance to help with the cancer survivorship outreach to gather information, primarily through focus groups, about what people need in terms of survivorship supports they may need, issues they may have had accessing them, what else do they need, what ideas do they have for additional support, et cetera. And we are going to be having those focus groups coming up. But prior to that, we have helped the VNA put together a survey for folks that really starts to gather this information that we're hoping will do a couple of things. One, sort of give a broader picture of what people may need, and maybe even have hopefully a broader distribution that we're able to get through focus groups. And also, especially as we get feedback before the focus groups are scheduled, to really help us fine tune any questions or things that we may want to probe additionally with people during the focus groups. So the surveys are available, I believe, now in Spanish and English, Jenna, and are available for your folks to complete. There's a flyer, which Jenna, I assume maybe you've either distributed or are going to distribute for folks, that has a scan code on it. People can just scan it and participate in the survey. We're really hoping that you encourage people to do that, to complete these surveys so that we can get this information. The flyer also includes the information about the focus groups. Here it is. Oh, you're pulling it up. Wonderful. There you go. So I don't have to read it off. Jenna will make sure that you have this. So there's the scan code for both the survey, and there is a scan code for the focus groups as well on registering. You can see they're scheduled for May the 18th at the Lakewood Library in Ocean County, and then at the 25th in Freehold at the Family Health Center on Route 33. So that's what we have planned. We're looking forward to doing this and to wrapping this up. The one thing that I wanted to mention to Jenna, and I'm sorry if I'm sort of catching you off guard with this, but I was wondering if perhaps we couldn't leave the survey open for a longer period of time than we originally envisioned. We originally thought maybe through next week or even the week after. You know, in thinking about it, Jenna, I don't see why we couldn't leave it open a few more weeks.
Yeah.
Even though it may have limited value in terms of influencing the focus group questions after the groups, it would still give a much broader picture. And we'd still be able to look at the survey results along with the focus group results.
I don't think
So,
that's a big ask at all, Gina. I think it's totally doable. I think it's valid, and I'm on board to do that. And I
yeah.
think our ask of the group here and our partners that you may be in touch with is just to look at your list of cancer patients, your previous cancer patients, your survivors, and their family members, their caregivers, and share this information with them. Let them know that they can contribute, and let us know what other patients may need, what they may need. And we're trying to get a bigger picture of what that looks like so that we could do better with our programming, enhance whatever we're working on, or enhance whatever may be happening in the community.
And Jenna, I'd like to add that it's especially helpful with these scan codes because almost regardless of income, usually someone in the family has a phone that could scan this. And, you know, I know in terms of my visit with healthcare practitioners that oftentimes there are little spots where you have to wait. You check in and then you have to wait. It'd be great if a family had their phone, could scan this, and while they're waiting to see their primary provider that day, they could do the survey. So we would encourage you to, you know, try to take advantage of those opportunities if you could.
Love it. Love it. Love it. Thank you, Gina.
All
You've been
right.
amazing to work alongside, and it's just really helpful to have the back and forth and open communication. So thank you everybody for listening to our pitch here on the survivorship initiatives, and I'll stop sharing the screen now. And I'll just ask, does anybody have any further questions for Lindsay before we go ahead and announce the next date? Okay. All right, so the next time that we're going to meet together is going to be on May 25th at 10 a.m. And we're going to hear from Hamed, which is the federally qualified health center in Lakewood, and they will be our presenter for that day. So we hope you can join us. I'll be sending out reminders to keep us informed of the date and time and how you can log in. But in the meantime, everybody have a great day. And thanks again, Lindsay, for presenting with us today.
Thank you.
Thanks, Lindsay.
Take care.